Let's talk about exams, medical board exams, with Dr. Kwafu, hey, hey. Everybody got around, hey, hey.
Hello viewers, welcome back to the Medical Board Exam Experience with Dr. Kwafu. Today we have Dr. Calvin Lee, a final year medical student of Jiangsu Medical University in China. He is currently doing his internship at the SCB Medical College and Hospital in India. He has successfully passed the USMLE STEP 1 exams, STEP 2 CK, and the India Medical Board exams, which is commonly known as the FMGE. Today he has joined us to share with us his experience on how he studied and prepared for the USMLE STEP 1 exams. In our subsequent interview with him, he will share with us how he studied and prepared for the USMLE STEP 2 CK and also the India Medical Board exams. Let us join Dr. Calvin in our discussion room. Thank you. Viewers, on this channel, I interview doctors who have successfully passed or failed any medical board exams to share their exams preparation experience with us and with all those preparing to write theirs. If you are watching me and you have experience in any medical board exams and would like to share with us, kindly contact me on my Facebook page, Instagram, or leave a comment at the comment section of this video and I'll keep in touch. Please do not forget to subscribe to this channel and recommend this channel to any medical student or medical doctor who is preparing to write the board exams of any country. Thank you. Welcome, Dr. Calvin Lee.
Thanks for having me.
Okay, so my first question is, on a scale of 1 to 10, how was your basics before you started preparing for the USMLE Step 1?
Okay, my basics actually, the contents of the medical studies in US and in China are really different. So if you compare my basics in Chinese standard, I would say it was around 7, 8. But compared to the US standard, it was 3, 4, I would say.
Okay. So at what point in your medical career did you decide to begin the USMLE journey?
I think it was around my second year that I first heard of USMLE. So I did buy a 2017 first aid, but I never read it seriously. So I just kept it in my dormitory till 2019. And then in 2019, I don't know suddenly why I felt compelled to sit for USMLE Step 1. So it was a very rash decision, a very sudden decision. So in the summer vacation of 2019, that's when I started to take Step 1 seriously. Yeah, it was in my third year.
Okay, so how did you start? Which resources did you begin with?
Okay, so Jiangsu University's library isn't exactly well stocked with USMLE resources. So the first book that I grabbed was called I don't remember actually, but that book had questions of USMLE. Then I was just reading those questions and I could not answer even a single question. And I was just thinking, well, in US, if the medical students take Step 1 in their second year, then I'm in my third year, I should be able to answer these questions with ease. But no, I was not able to answer even a single one. And then what I did was I realized and I accepted my basics are really bad when it comes to the USMLE. So I picked up this pathology book called Golian's Pathology. And you won't believe the edition that that my library had was a second edition of Golian's Pathology. It was printed in 2007. Wow. But that was the only book which our university library had. So I just borrowed it and I read from cover to cover. There were some wrong information. I mean, medical science has changed a lot since 2007, but most of the things in the book were the same. Okay. So that's how I started. I read the pathology and then slowly I read the anatomy and the physiology and all these things.
Okay, so how long did it take you to go through the whole Gojan book?
I think the whole Gojan book, it took me around a month.
Okay, so that was just for pathology.
That was just for pathology, but one thing I found is that book actually clears up a lot of topics and a lot of concepts that they test in step 1. So after that, I really didn't have to do much. Biochemistry I had to revise, anatomy I had to revise. That's it.
Okay, so which resources did you use to revise the other subjects?
Rapid review. Like we have this Linda Costanzo rapid review for physiology. So the same thing I did for other subjects because I didn't have much time. It was a rush decision. If you look at the time from when I took the decision to sit for step 1 and the day when I actually sat for step 1, it was like 4 months. So in those 4 months, 1 month went for Golian review. The other 3 months, they were, for UWorld and those things. So I didn't have much time.
Okay.
Other subjects, I just went through BRS, board review series, rapid review, that's it.
Okay. So that means you used 4 months to prepare for these exams?
Yes.
Okay. So what are the main resources you used? You mentioned Gojan and rapid review. What were the core resources?
The core resources, offline QBank, offline NBME, and yes, board review series and Gojan. Those were my only resources.
Which QBanks did you use?
UWorld offline, which I got from Taobao. So that is there, but it was a huge mistake actually. If you look at my step 1 preparation, it was not well planned, it was not well executed. Actually, if I could again sit for step 1, what I would do is I would buy online QBank because it actually helps you understand your level. It gives you percentages and everything. It gives you analysis of your weak subjects. It has explanations with pictures. So actually, although UWorld is expensive, you can chip in with some friends and you can use it. But I would highly recommend to not use offline UWorld and offline NBME. Yes, and I would also advise people to start earlier because, I don't think Golian was that detailed. I think if I did Pathoma, that would be better. That would have been better. But anyways.
Okay, so you didn't do Pathoma after the.
I did not do Pathoma, because I was like, well, Golian pathology, that's one book. Then Pathoma is even thicker than Golian. So I went for the thinner one.
Okay. So you use Gojan, you use offline UWorld, offline NBME. Those are just the 2 question banks you use.
Yes, those are the only 2 question banks I used. And also, the problem with offline UWorld is I don't know where I am. I will just randomly open one folder and do questions. There was no system. I did not actually use it properly.
Okay. For there are a lot of lectures available. We have the Kaplan, Boss and Beyond, sketchy videos. You didn't watch any of those videos?
Okay, so now the thing about staying in China is, you are literally cut off from the rest of the world. I did not know Pathoma existed until I appeared for step 1. I didn't know about Boards and Beyond, and I didn't know about Kaplan. So, I just grabbed whatever resources were there in my library and whatever resources I could find in Taobao. But yes, I've heard a lot of good comments regarding Board and Beyond, sketchy farm, sketchy micro, those things. So yes, I would, actually the way I look at USMLE is that it's a marathon and you need to plan your strategy carefully. And being in a hurry is not good because you can only sit for this exam once. If you pass, and if you fail, you can sit for it again. But the thing is, it will be a huge red flag when you match for residency. So you don't want to fail, and you don't want to pass with a low mark. So you have to plan your strategy correctly. You have to get hold of the resources, the important resources, and you have to, prepare yourself well before you sit for the exam.
So basically, you used Gojan, offline UWorld, offline NBMEs, and
yeah,
you didn't watch any Kaplan videos, Sketchy, Boss, and Beyond. Did you do Ankai
no,
questions?
I didn't do Ankai also because I didn't know there was something called Ankai.
Okay.
That was how ill prepared I was for the exam. So,
Okay. Okay. So you use 3 main resources? Just 3?
Yes, just 3.
Okay. So during the exams, okay, how were the questions during the exams?
So actually, I sat for the exam in 2019. Step 1 has changed a lot since then, and I'm lucky I sat for it earlier. So 2019, the questions were similar to NBME 15 to 20. So
Okay.
I did those NBMEs well. And the questions, they were, I would say, okay, a little difficult. But it was similar to NBME 15 to 20. And later, this NBME 21, 22, 23 to 30 has come out. And, those are really, really tough.
Okay.
If you ask me, that time, I would say, yes, it was easy and I could have done better.
Okay. So you think the UWorld helped you?
Yes, UWorld has helped me. Offline UWorld helped me to some extent, and online UWorld would have helped me even more, I believe. So yes, UWorld is essential for USMLE.
So the concept that are tested in the exams, did you finish the whole UWorld? Actually, did you finish?
I didn't finish the whole UWorld because I didn't know exactly where I was. It's offline. You have all these files and folders. You don't know which file and folder you opened yesterday. So, it was very confusing. But okay. I believe I didn't go through the whole UWorld.
Okay. So you think the concepts tested in UWorld, did you find similar concept during the exams? Yes.
The concepts were similar. The knowledge is similar. Just that the way they ask you the same concept is different. But the concepts that US wants you to learn and wants you to learn well, that's there in UWorld.
They're in UWorld, right?
Yes.
Okay. So you said you bought the first aid in 2017. That means you knew about first aid. Why didn't you use it? Did you use it during your preparation?
Yes, I used my first aid during my preparation, and I used the 2017 one. It's a big mistake because if you compare the 2017 first aid with 2019, the year when I sat for step 1, there's actually a lot of difference, a lot of new things. First aid is actually it's so famous that even in China people know about it.
Okay.
But that's basically it. The other resources, sadly, many people don't know about it.
Okay, so how well did you study the first aid?
The first aid, I studied it. I would say I retained about 60% of the information. But now when I look back and I reflect on it, first aid is more of a checklist than information book or a reference book. Why do I call it a checklist is because it has little of all the concepts that you need to know, but you cannot use it as a source for knowledge. So when you come across a concept in first aid, you have to make sure that you know it well. It's like a checklist. So, okay, this is there. Do I know it? Yes, I know it. If I don't know it, then I have to go to, let's say Pathoma, Kaplan, and again revise it. So many people, they use first aid as a source of knowledge, but it is not. Because, if you don't have knowledge and you look at first aid, it will be a waste of your time. And I retained only 60% is because I didn't have knowledge and I could not retain any more.
Okay. So if you are to prepare for these exams again, what will you do different? Now that you are aware of all those resources, how will your study schedule be? What resources will you focus on?
Okay, so I would first change from Golan Pathology to Pathoma. And Pathoma also, if you buy the subscription, you have video lectures. I would watch them. Then I would watch Both and Beyond. Then I would go through first aid. I would take the most recent NBMEs because they reflect the kind of questions that comes in the exam, and now it has become tougher. So I would take Online UWorld. Online UWorld now has a lot of fancy functions like notes, flashcards. UWorld also has a very nice, concise, and short explanation.
Yeah.
And I would do online NBMEs, not the offline ones. USMLE is a expensive journey, but I think there are ways you can cut your expenses. So yeah.
Okay, but you've heard of Anki. You wouldn't incorporate Anki into your studies?
Yes. So Anki, the way I look at Anki is it helps you with rote memorization. In biochemistry, you may use it, but in in anatomy also you may use it. But the bulk of step 1 is pathophysiology. You have to understand pathology and you have to understand the physiology. So Anki, you can spend time on specific subjects like biochemistry and anatomy, but I would not advise you to spend more time on it. I would actually advise you to understand rather than remember. USMLE is actually the kind of exam that tests your understanding. So it's not rote learning. Anki will help you make decisions quicker in exam, but I think the amount of time allocated is plenty enough. You don't have to actually be in a rush.
Okay. So now, if I put it to you to give me, if you are giving 3 months to prepare for these exams, now, 3 months, how will your study schedule be? 3 months.
First thing is I would go to the Prometric Center and I would delay my exam because 3 months is really short, and I would not recommend people sitting for 3 months unless they get nice score on NBME, which would mean that their foundations are clear. So actually, the time when you would sit for the exam depends on how well you score on your NBME. If you score really well, you can sit for it within a few months preparation. If your NBME scores are bad, then it's best to delay it. You don't want this score to affect your matching. So if, let's say, you have 3 months and your NBME scores are good, then I would suggest people to use UWorld. UWorld has this reset option. So you can reset the Q bank, you can do the Q banks. Now, when you buy UWorld subscription, you can also, you also get 2 assessments, do those things, do NBMEs, and revise first aid. That's it.
Okay, so if you are to prepare, you will focus on UWorld, NBMEs, and first aid, and also you mentioned Pathoma.
Pathoma, actually, Pathoma is not, let's say, it's a huge book. You cannot actually go through everything in a few months' time. So what I would suggest is, early in your preparation, you can go through Pathoma. You can underline some important information, but later, it's best to just stick to UWorld.
Okay. Do you think if one focus on UWorld and try to know everything in the explanations, only UWorld, the person can pass the exams?
Yes, if you do it properly, if you use it properly. Like, for example, let's say in UWorld, by fluke or by chance, I get a question correct. If I go through explanations, like as in why this option is wrong and why the correct option is correct, if I pay attention and use it properly, then I would be able to perform well.
Okay, so you think UWorld, the content in UWorld is enough to pass the exams?
Yes, the content in UWorld is enough to pass the exams.
Okay, so the NBMEs you took, how was the scores? Were you able to score yourself?
I was not able to score myself because it was offline, but I could tell you the percentage. I just took a percentage. My percentage was somewhere around 60 to 70, and that is not good. So if you put it in three-digit scores, I would score somewhere between 230, 220, 230, like that, with 60 to 70%.
Oh, okay. Okay. All right. So is there any advice you have for anyone preparing for these exams?
Okay, so if you are going to prepare for USMLE, decide as soon as possible, because for matching, they have this concept that old graduates are not preferable. You have to be a fresh graduate. It increases your chances of matching. Most people, they sit for this exam only after the graduation. But the thing is, if your concepts are not clear, it'll take you a longer time to clear those exams. And by the time you clear the exams, you'd be an old graduate according to US standards. So if you really want to go to US, start while you're a college student. And while filling in your application, you have to be very careful. Go to Facebook, go to those USMLE forums and see what resources other people use. Start early, start sincerely. Then passing this exam and getting a nice score in it is actually possible. It's very much doable, I would say.
Okay. All right. Thank you. Thank you very much, Dr. Calvin, for joining us. We hope to have you again on our platform.
Thank you.
Let's talk about exams. Medical board exams. With Dr. Kwafu, hey. Everybody got around it, hey. Let's talk about exam. Medical board exam. With Dr. Kwafu, hey.